Hello, my name is Russell, and in this video I will be talking about vascular diseases of the CNS, also known as the central nervous system. These diseases include stroke syndrome, transient ischemic attacks, interparenchymal hemorrhages, and subarachnoid hemorrhages. This here is a representation of the inner layers of the brain, and what I wanted to show you most of all was the layers that represent the white matter here, the gray matter here, also the pia mater, blood vessels, the arachnoid matter, which is this thin membrane sheet here, and the subarachnoid space, which is right in between the subdural space and the arachnoid matter. In this image, I'm just going to explain a quick overview of the brain, and you could ignore the numbers of the flow here. But basically, what I wanted to explain to you was the arachnoid villas, which are right here, represented by this line. You have your superior sagittal sinus, which is the blue here, going all the way around. You have your subarachnoid space, which is the lighter blue on the inner layer here, going all the way around. And then you also have your dura mater, represented by this small line here, and it's pointing at the thin membranes separating the outer layers of the subarachnoid space and the arachnoid space. First, I want to talk about stroke. And according to the American Heart Association, as well as the American Stroke Association, a stroke is defined as a symptom complex resulting from impaired blood flow and ischemia in the brain's blood vessels. Stroke is also known as a vascular accident or cerebrovascular accident. To recognize a stroke, those of us in the medical field would look for signs such as sudden weakness of arms, legs, and or face on one side. Also, sudden trouble speaking, sudden vision problems, sudden trouble walking, problems with balance, problems with dizziness, or sudden severe headaches. The best modality to view stroke would be MRI, because it will provide accurate data on intracranial vessels, brain perfusion, and can rule out other causes such as infection or even tumors. Another modality that can be used is the cerebral angiogram, and this modality would be able to provide high-resolution cerebral x-rays to treatment of stroke. And according to the New England Journal of Medicine, treatment is significantly effective if given within the first 3 to 4.5 hours of stroke onset, and produces benefits to approximately 12% of stroke patients. A type of treatment would be a catheter that is inserted into the aorta and then moves into the carotid artery. From there, a microcatheter is guided on a wire into the intracranial vessel of interest via fluoroscopy, at which point the point of interest is threaded by a balloon. The balloon inflates, grabs the clot, and pulls it out. Now, finally, I want to talk about the morbidity and the mortality of stroke. Now, stroke is the leading cause of serious long-term disability in the United States, and it accounts for 1 out of every 17 deaths. In 2005, the mortality was 137,000 deaths, and now in 2018, stroke death rate has fallen 30%. Here is an MRI scan of the brain. And on the left side here, this radiolucent area is a sign of stroke. And also here on the right side, this radiolucent area here is another sign of stroke. Moving on, I would like to talk about transient ischemic attacks. It is described as an ischemic attack of a focal spot or restrictive blood supply due to a blood vessel's damaged or dysfunctionality, but it is not accompanied with permanent brain infarctions. This results in oxygen and glucose depletion, in turn resulting in infarcted tissues. The modality most used to diagnose transient ischemic attacks would be tests of the carotid artery using ultrasound to determine whether there are blockages or narrowings, but also MRI and CT may be able to determine the severity and location of the blockages, morbidity of the transient ischemic attacks. Now, in general, these are basically like a small stroke, and the morbidity varies greatly due to certain factors such as hypertension, diet, smoking, and exercise. Now, for treatment of transient ischemic attacks is basically there is no treatment. These are just attacks, and if they were to become chronic attacks, eventually they can become much more serious and result in a stroke later on. Transient ischemic attacks is a temporary blockage of blood flow, represented by the blue section of the brain, and it can occur by a blood clot in the middle cerebral artery or blockages in the internal carotid artery. At this point, I would like to move on to subarachnoid hemorrhages. And according to the Journal of Respiratory and Critical Medicine, subarachnoid hemorrhages are described as bleeding into the space between the pia mater and the arachnoid membranes. This is typically due to ruptures of arterial aneurysms or dilations of bifurcations of large arteries such as the circle of Willis, where it is 90 to 95% more common to see a subarachnoid hemorrhage. Now, the best modalities to view a subarachnoid hemorrhage would be the MRI. But also, we can use a CTA, which is a CT type of angiogram. And in this angiogram, the subarachnoid hemorrhages appear to have high attenuation in the subarachnoid spaces. Treatment of the subarachnoid hemorrhage would be a craniotomy surgery, and then microscopically locating the aneurysm and then alleviating the aneurysm after it's been located. Now, the morbidity of subarachnoid hemorrhages is only about 5%, and these occur in adults between the ages of 45 and 65. This number can be increased with patients that have hypertension, a history of drug use, a history of smoking, and also women who are pregnant or have been pregnant. These two images show a parenchymal hemorrhage or a cerebral hemorrhage of the brain. And in this transverse image of the brain, here representing the parenchymal or cerebral hemorrhage, and in this coronal image of the brain right here represents the parenchymal or cerebral hemorrhage. Now I would like to talk about intraparenchymal or intracerebral hemorrhages, and I will refer to them as intracerebral hemorrhages. Now, according to the American Journal of Respiratory and Critical Care Medicine, an intracerebral hemorrhage is a hemorrhage that is referred to as a non-traumatic bleeding into the brain's parenchyma, and the mortality rate in the first 3 months of this hemorrhage is about 35 to 50%. Also, the main cause would be hypertension, and secondary cause would be aneurysms. Clinical symptoms include stroke, seizures, headaches, nausea, pain in the neck, altered consciousness, and other neurological defects. At this point, I would like to talk more about intracranial hemorrhages and where they come from. Now, these hemorrhages can result from a weakness in the wall of a blood vessel or where a blister forms in that blood vessel. Now, typically, they form at branches or junctions where arteries split into two. And also, they can come from an area known as the Circle of Willis, the modalities of intracerebral hemorrhages. And the best modality would be MRI, but this can also be seen in CT scans. Now, in CT scans, they appear as white areas and are frequently found in small perforating vessels like in bursa ganglia, the cerebellum, and areas of deep white matter. The treatment of intracerebral hemorrhages, according to the American Heart Association and the American Stroke Association, is that prevention, like controlling hypertension, diabetes, smoking cessation, weight control, and physical activity would be overall the best treatment. Here is a CT scan of the brain, and this scan is a transverse scan that's showing us the subarachnoid hemorrhage. Here in this radiolucent area around the brain is showing signs of bleeding, which is the subarachnoid hemorrhage.